Most providers hear these terms and have no idea what they mean. Your MP Pal here. Welcome to another lesson from the track. All right, so today's segment, I want to talk about the FCE, the MMI, the DDE, and the IR, and what they actually mean. All right, so today's the final video in these workers' comp series, and this is more about just informing you, okay? Now, I know I've been working a lot, and if y'all seen these terms just kind of over the years, just in certain patients' charts, mainly if the case has been going on a long time, like 6 months or more. And honestly, up until a year ago, I had no idea what these terms meant. I would just see MMI or FCE, and I'm like, what is that? So today is just more about giving you this information because we don't have to worry about this in urgent care, especially not us actually ordering any of these tests, okay? All right, so first up is the FCE, Functional Capacity Evaluation. This is basically what the person can do, all right? So again, this is months into the case. So they've had multiple rounds of PT, they've been on medications, may have even had an MRI, and it's more about trying to get them back to like taking them off restrictions and getting them back to work, okay? So at what point this is ordered, again, multiple months into the case. Usually done by either the medical director or the specialist, but who performs it is either physical therapist, occupational therapist, or like a designated rehab doctor, okay? So things like lifting, bending, pushing, carrying, and things like that, like can this person get back to doing their job? But it's just focus on what they can actually do, okay? All right, so that's the first one, that's the FCE. The next one is the MMI, Maximum Medical Improvement. Basically, when the patient is just not getting better, all right? So again, months into the case, they've had imaging, they've had PT, and it's just they've hit this plateau at some point where they're just, okay, well, you've been having this really bad injury, it's ankles, wrists, shoulder, and it's just not getting better. And basically the specialist is kind of to the point where they're like, I don't think this is gonna get any better than this, okay? And so they do this, they perform this, typically by the specialist, and yeah, they will mark it down and kind of say, this patient probably won't get any better than this, all right? So now I'm explaining these things in a particular order, but that doesn't necessarily mean that they're gonna happen in this order, okay? Because sometimes they can just go straight to the MMI without doing the FCE. So they don't necessarily have to get the FCE first, okay? So they can be interchangeably, but if it's long-term, it's a problem, and they are leaning towards like something permanent or like long-term, you're probably gonna do the MMI, okay? All right, so next up is the DDE, the Designated Doctor Exam. So this doesn't have anything to do with what the patient can do. This is when there is a dispute, right? So when either the patient does not agree with what the doctors are saying, or the employer don't like what either the patient or the specialist are saying, you may have two specialists that disagree. Let's say if one want to perform surgery, the other's like, no, we can do this, with just therapy. So this is a third party evaluation, somebody that's neutral, that is outside of the providers that are on this particular case, okay? So typically by the workers' comp people are gonna order this. So again, none of this stuff you have to worry about, it's just more informative, okay? But if you see that somebody had a DDE, there's some kind of dispute. Somebody's not agreeing with the treatment or what's gonna happen, okay? All right, and then the last one is the IR, the Impairment Rating, which measures permanent loss of function. So let's say somebody had a pretty deep forearm laceration and cut tendon, there was some nerve damage and stuff like that. They had surgery, had therapy, and it's just this kind of long-term thing where this is just probably what it's gonna be, okay? So it's actually a percentage of the damage loss, all right? So, and they let's say there was some nerve damage and they have like a 15% nerve damage loss, okay? So that's what the impairment rating does. So that means the patient, most likely long-term, I don't want to say forever, that's such an absolute word, but they're going to be having this problem for a very long time, okay? So they probably won't be able to, perform at an 85% level if they have this 15% permanent loss, okay? And that's the thing with these, with the injuries. And so why I stress the documentation piece is so very crucial, because especially if you're seeing them weekly and it's like, all of these pieces are connected. And so if the patient's not getting better, if it's the same, if it's just, so again, because that kind of leads into these later in the case problems, okay? And I don't think it's the same across the board, but I think you have up to about 2 years, I think, for like a workers' comp case, okay? So that's pretty much it, all right? So the 4 abbreviations that you may see, the FCE, functional capacity evaluation, what the patient can do, MMI, maximum medical improvement, they're just not getting better and probably not going to improve anymore beyond that. You have the DDE, designated doctor exam, when there is a dispute, and then you have the IR, the impairment rating, which measures the permanent damage, okay? All right, so that concludes this workers' comp series. I hope that you found this informative, and hopefully you can take some of this knowledge, this wisdom I'm passing on, and to apply it to your practice, okay? All right, so if there's any other topics that y'all are interested in learning or want me to talk about, how I break things down, put it in the comments below. If you found this information helpful, hit the like button and subscribe. Your MP Pal here, as always. Think clearly, practice boldly, and I will see you on the next one.